What's up everyone, it's Ohan, and this video is about things I wish I had asked my surgeon prior to being under anesthesia. Real brief, because I don't like talking about it anymore. I thought I was getting double incision, regular standard double incision with scars and nipple grafts above. That's what I thought was happening. Clearly there was some kind of misunderstanding or miscommunication. That's not what ended up happening, and now I get to ruminate with all of the things I should have or could have done. But the good news is, now you don't have to ruminate because you can learn from my incompetency. And I'm being really harsh on myself. I'm not responsible for this. This is not my fault. But there were a lot of things I didn't know that now I know and wish I knew that I want you to know. Okay. The first question, where will my scars be? It sounds really dumb and almost obvious because prior to having my procedure, I had only ever seen them in one place. So I didn't think that that was a thing I needed to ask. You know, can't be too sure. No question is a dumb question. Where the F will my scars be? That's a question you can ask. This leads me to my next point, which is what shape will they be? Because even if they're going to be below your nipple graft, there are so many different ways that they can be, actually. Even just below, there are plenty of ways they can be. Some guys have straight across scars. Some guys have more curved, like this. Some have like a slight curve that goes with the pec muscle. Some that I've seen that are like really slanted, like this. So there are actually different shapes. There are actually different shapes of scars that can be underneath your nipple graft, and that is a thing you can ask your surgeon. Not only ask, but also state a preference of what you want. Hopefully that's possible, but if it's not possible, they'll explain why and explain to you what is possible. And that never happened to me in my consultation because I assumed they would be a certain way, and it's partly my fault for assuming, and it's partly my surgeon's fault for like not talking to me about it. So there. Okay, so yeah. And then the last thing that I wish I asked is a contingency plan. And what that means is if we can't do this preferred thing that we talked about, I want my surgery to be like this, do you foresee anything coming up that would prevent my dreams to come true? Okay, for example, if you want to do a buttonhole surgery, meaning you don't have a nipple graft, your nerves aren't severed, and what happens is your native areola and nipple are flipped underneath your incision and brought to the acceptable, normal, whatever male placement of nipples. Okay, you could say, like, I really want to retain nipple sensation, I really don't want to do nipple grafts, and I really want the buttonhole procedure. But ask your surgeon, like, hey, what if you get in there and for whatever freaking reason, I'm not a surgeon so I don't know, whatever reason it's not possible, what are you going to do? And then he's going to say, probably. In that case, then we'll just do a nipple graft. And then you actually have time to process that, like, this is my preference. If my preference doesn't happen, I'm going to be left with option B. I never had an option B. No one told me, I didn't know. And I think it's a lot more terrifying if you have no fucking idea what you're about to see, and then someone shows it to you. You know, if you can go over a plan that states clearly what your preferences are and why, and then your surgeon is going to come back with options of why that can or can't happen, and then say what a plan B, C, D, whatever. Go over all the plans. Talk about it all. Talk for days. Call her up at night. I don't know what you're going to do, but just figure it out. Because surprises suck. They fucking suck when it's your body and it's like that semi-permanently unless you seek a revision. I started researching top surgery in about 2011, 2012. That's when I decided in my mind that this was a thing that was going to need to happen in my life eventually. I don't know when, but eventually. And I didn't seriously start looking into it until 2015, and then I didn't get it until 2016, and by that time I was in so much pain from binding for 5 years that I just couldn't wait. Like, of course I had preferences of surgeons that I wanted to go to, but I couldn't wait, and part of the reason I had to wait was because of caretaker, and that sucked because I think about that often, is what if I just waited a few more months, but I actually couldn't have waited a few more months. I mean, if yeah, I was in so much pain, and not even just pain with the binder on, but with the binder off. Like it had fucked me up forever, and it still does, and I'm still in pain, and I haven't been binding for over a year. So, yeah, long-term effects of binding are real. We don't really know what they are because I think there's been one study, as far as I know, posted about long-term effects of binding. But what I'm saying is, like, I doubted myself for so long. Like, I made the decision in my head, and then I just kept going back and forth about it. And I just wish that I know that everyone takes their own amount of time to make and process decisions. I just wish I had a little more faith in myself because I did know what I wanted. I just couldn't take that step. And as a result, it caused me to make, I don't want to say rushed decisions because I don't even think it's possible for me to make a rushed decision. I'm very deliberate with everything I do, but I just wish I didn't wait until I was in the amount of pain that I was in to make a really difficult and lasting decision. So that's what I wish I knew about top surgery. I hope this was helpful. These are my results. Obviously fucking not common. I know people are gonna say it looks fine, or, you know, actually it works with your body or whatever. Like, at this point, it's not even the point. It's just that I didn't know what was happening. And it also depends on the angle. Like, if I'm sitting up with a really fantastic posture, which is basically never, everything looks fine. But as soon as I start to sit or flex or bend, really, like, I have this whole side of tissue and, like, of just breast tissue that really goes around this whole side. And then this side is less tissue, but if I bend, it still has that skin that's just left over, like, here. It's not the worst thing that could have happened, for sure, but it's certainly not what I expected and not something I'm really comfortable with all the time. I will say I have good days and bad days. There's some days where I look at it and I'm like, hey, I'm kind of happy this happened. My scars aren't as long or something, and I have a, oh no, my shirt's backwards. I do have a positive thought here and there, but for the most part, I'm not thrilled. I am seeking a revision. I think I'm trying to get one with Dr. Garamoni, who knows when, hopefully in August, but it's going to be tough. I don't know. I really don't know. But I'll keep you posted as I do know, because I'll be very excited to announce when that's happening, if it ever happens. So, yeah, anyway, thanks for listening, thanks for watching, and I will see you next time. Bye.